So I was 26 and I was having a lot of bloating. I went to the doctors, got some IBS pills, and then at 28 was still bloating, and then went and had an upper GI and everything was good. But then at 30 I started cramping, and before that, I can't remember the timeline, but I did have small stools, I did have bleeding, I did have times where it was just mostly diarrhea and not full bowel movements, but I didn't know if they were all related, especially when I had already been told that you were too young for any of these bad things to happen. So I did have the classic symptoms. I just didn't really put them all together until, it came so that I couldn't function anymore. What actually got me diagnosed is I started having severe cramping on my left side, where it would actually swish, make this swishing noise. And she says, well, it says you have a 4.5 centimeter mass on your liver and a 5 centimeter mass on your colon. So of course we said, what does that mean? Is it cancer? What do we need to do? And she says, it's out of my realm. And we didn't actually get the diagnosis until 4 days later, and that it was colon cancer. But he said, it's colon cancer, it's stage 4. And we said, okay, well, how many stages? He's all, 4. Very matter of fact. And we're like, okay, well, what's next? When do we meet the oncologist? What do we do next? And that was kind of just how we proceeded through the whole treatment. My impression with Dr. Lowy was great. He wasn't going to do it if it didn't succeed. If he didn't think that the things that were going on in my body weren't the right conditions, he wasn't going to do it. So I felt very comfortable in his team, and being with his nurse, Debbie, they're all very excited about what they do and passionate. And so being in Dr. Lowy's hands, I never was fearful of what the outcome was. The way I tell people when I meet them and they are like, oh, what did you have? I said, well, first of all, they cut me from here to here, looked to see if I had any cancer, took out spaces that were, ended up being scar tissue and not cancer. The only place that had cancer when we went back in was my right ovary, which they removed. Closed me back up, poured hot chemo in, and physically shook my abdomen for 90 minutes. And then got the chemo out and then actually glued me up. So that's why my friends call it the chemo martini, shaken. But I just never once thought I couldn't do it. I always just thought of the next day and the next treatment. I worked most of my treatment. I had amazing friends and family. I developed a saying that we printed on some sweatshirts and shirts, and it says, cancer is lame, but nothing is impossible. They call it a marathon instead of a sprint. I feel like when you take your treatment into your own hands, you feel more confident and you feel like you're doing the right things. And asking the questions, I was afraid to tell my doctor certain things because I didn't know they were important. So having that open dialogue and with your patients, making sure that you all know what's going on with that patient and that they're not afraid to tell you things. It happens to young people, it happens to females. Females especially need to know that they can have that conversation with their doctor, and that a colonoscopy is always an option. I had my HIPEC in May of 2012, so I consider that my birthday. My first day that I was no evidence of disease.